There's no randomized controlled trial of jumping out of an airplane with or without a parachute. Common sense is allowed to prevail at times.
We would never do a study to determine if anesthesia has any effect upon the extraction of wisdom teeth. There's certain things that are just unethical. You cannot make a control sample by withholding treatment that may have some benefit.
Having sleep disordered breathing in its own right is a risk factor for cancer.
If you don't get the child nasal breathing, especially during the nighttime, you have not fixed that child problem. People say, do you take cone beam CT on all your patients? And the answer, yeah. I do. Because if I don't, I'm going to miss something. Yep. So essentially that cone beam is exponential amount of imaging, because you can look at the TM joints, the nasal cavity, the septum, the turbinates, the adenoids and tonsils.
I can give you a list of health implications of mouth breathing that are far more significant than having this argument about teeth and dental development. They're just going to see a child that's having learning problems and behavior problems and struggling through life, not realizing that is a manifestation of brain function, which is then a secondary manifestation of the fact that the child is not breathing properly, which is then tying in with the fact that they're not sleeping properly.
The problem is that the educational system doesn't lend itself to early treatment.
Yes.
I'm finding at least 30% and probably more than that of issues in the nose, deviated septums, large turbinates, narrowness to that area.
When we come to the AHI, the original historical numbers that were used in kids were based on adult numbers, and those adult numbers were totally made up. There's nothing about it that was correlated to disease outcomes. A normal sleep study does not mean normal breathing. I can literally count on my fingers and toes in the past 20 odd years as being an ENT primarily focused on sleep disordered breathing, where I have felt I needed a sleep study to work out what was going on. Your insurers in their big projections could be saving themselves billions of dollars by opening the door to getting these kids in early and getting them fixed, rather than picking up the consequences of obstructive sleep apnea in adults. If you were to say it's negligent to treat a child early, it's negligent to dismiss a mouth-breathing child. That's a greater level of negligence right there.